My name is Tom Willman, physical therapist. Today, we're going to talk about McKenzie exercises for lower back pain and sciatica. At the end of this video, you're going to get all our great exercises, ones you can do at home without any special equipment. And also at the end, at the very end, we have a bonus exercise you do not commonly see. We use it here in the clinic with incredible results. So stay tuned to the end for our bonus. Oftentimes, you'll hear people say, well, I'm doing McKenzie exercises. There's certain exercises that are associated with the McKenzie, what they call method. The McKenzie method is actually an evaluation where we take you through a series of movements and we try and find out what makes your back feel better, improves your leg pain, and improves your function, but it's based upon how you move. One of the most common exercises you'll see a standing arch or something called a prone press up, like you do a push-up on the ground. But that's not the only exercise. They just happen to be one of the most common exercises that we give out in the clinic. You can also have people that do repeated flexion where they're bending forward and to kind of stretch their spine into flexion. But a lot of what the exercises we're talking about are associated with extension, which is arching. But that is the McKenzie method. It's based upon how you respond to exercise. So realize when you do these exercises on the end of the video, that is the only caveat, is that these are the ones we commonly give out, but by no means are they the only ones. So when we talk about lower back pain and sciatica, it's more of a description. It's really saying that there's pain in some area. That pain could be coming from something else besides your lower back or the sciatic nerve roots. It could be actually coming from an organ. It could be coming from something that's referred to that area. So we got to be careful about the use of that term. And sciatica is basically something that's affecting the sciatic nerve roots, but it's really not giving a guidance on what the true diagnosis is. Is it related to a disc herniation? Is it related to a tight muscle that's pinching the nerve, like a piriformis syndrome? Is it related to inflammation around the nerve or arthritis or something that's causing that sciatica to become symptomatic, giving us pain, symptoms down into the leg, possibly into the foot? So keep that in mind, that those terms are kind of really don't get to the root of really what we're talking about and are merely kind of descriptive and purely give us an idea, but are used a lot and commonly misunderstood. Okay, so let's go through a little bit of anatomy here just to kind of get our general bearings here. This is a little spine. This is the front of the spine. This is the back. Okay, this is your hip girdle, pelvic girdle. This is your sacrum, that triangular bone. And when we're talking about problems with sciatica and lower back, most commonly, a lot of our problems come from the lower lumbar spine. This is the lumbar, and that means the lower 5 vertebrae here. So when we name them, we actually number them. You'll see them numbered or hear of them numbered. So these intervertebral bodies are, this is L5, L4, 3, 2, and 1. In between those bodies, there's disc material like cartilage here. A little different material. These are our disc segments. So if we're talking about the L4, L5 vertebrae, you have the L4, L5 intervertebral disc. That's a disc in between. You can see this little mass here, and this kind of helps with shock absorption and mobility and such. Okay? Off the side here, you'll see these little yellow marks right here, these yellow strands, is some of the nerve roots coming off the lower back. A series of 5 of them coming off the lower lumbar spine all come together as a big bundle, and they call it the sciatic nerve. Okay, and that'll run down the back. You'll see it. This is the back here, coming back through here. You'll see it coming out, down, and it actually runs down your whole leg. And then give you symptoms of pain, tingling, numbness, sometimes weakness down the leg. Sometimes both, sometimes one side. So depending on what's going on, different things can give you sciatica or irritate or pinch the sciatic nerve root. And some of those things can be, one of the common things that we talk about are disc problems, whether it be herniation, bulges. Sometimes they'll use the terms prolapse, but something that's not perfect inside that disc segment might be resting or pinching that nerve root. But you can have other things. You can have muscles that are tight around the area, like a piriformis syndrome, which is a muscle in the back here that essentially will pinch that sciatic nerve root. It could be related to inflammation. It can be related to something going in as far as bony abnormalities or something that's less than perfect. It could be stenosis. All these things can give you some irritation that causes sciatica. So you understand, sciatica is just an outgrowth or a description of something that's going on that's not working great, that's affecting the sciatic nerve. Hope that clarifies a few things. So one of the concerns is people with lower back pain and sciatica are nervous and they're scared and they want to make sure, the question is this a safe exercise for me? Great question. So one of the things we tell people when we're doing some of these movements, sometimes we'll have someone do a lower back arch exercise, sometimes we'll have them do a standing flexion, is we have to know where our pain is at the start. So we want to know, okay, where does it start? So let's give you an example of this. Let's say you have someone that comes to us and they say they have pain in the lower back and they have it kind of halfway down. They said it never goes past my knee, but it's all the way through here. That's where I'm getting pain. So when they start the exercise, what we'll tell people is, as you're doing this exercise, let's say they're doing an arch exercise like this, okay? And they say, wow, at the start of the exercise, my pain was here. Now it's moving up. That's a good sign. Keep on doing it, all right? If they start doing the exercise, or you're doing the exercise, and you're feeling, wow, now I'm getting pain that's going lower, and it's going past, down into, let's say, the calf or the shin area. That's a sign that we have to stop. Either one, this exercise is not the right exercise for you, or two, maybe you're just not doing it correctly. Okay, it could be a couple different things. But it's very important. Centralization, the pain is moving towards where we think it's coming from. Maybe we think it's coming from the back. Peripheralization, it's kind of running away. It's moving away from the origin of the pain. Is 99.9% of the time is not a good sign. So we want to stop the exercise and don't, discontinue. But that, if you listen to that basic framework, you're not going to get in trouble. All right, but you got to do it gradually. You do a set of 10 repetitions, let's say, or 5 repetitions. It's getting worse. It's going further down your leg. Stop. All right, but it's a very good guideline, and we use it continuously in the clinic here. And most people don't get in trouble when they listen to those basic rules. So it's centralization, peripheralization. Sometimes the only little nuance there is occasionally as it's going back, and you say, "Wow, it used to be in my leg. Now it's just here." It actually feels worse. Keep on doing it as long as it's still going to the center there, okay? That's one of the most important things that make the safety in the system here. The other thing that you want to consider, besides the movement and how the pain reacts when you move your back, that's centralization and peripheralization, we want to be aware of, before we even start, some of the things we'll talk about is you should not have any changes in bowel and bladder. If you're starting to have an impairment in the ability to have a bowel movement where you can't keep you're incontinent, those are signs you should stop and go straight to the ER. Okay, the other one is progressive weakness. Serious weakness, you're all of a sudden starting to be very unbalanced, you feel very weak, it might even be what some people call a drop foot. Something of that nature, you want to see a doctor first. You don't want to do these exercises, okay? Another thing is we'll talk about balance problems that are kind of connected to that weakness. You're really off balance. Another situation is also numbness, or they call paresthesia numbness, in the saddle region, in this region right around your buttock and in the saddle region. Those are signs that you're affecting certain nerve roots that we don't want to do these exercises until you get a formal evaluation from a doctor. Okay, so keep that in mind. There's a few things. We have in our playlist, we also have 2 videos on when you need an MRI and red flags, which are those things that we just described are red flags, meaning we should stop and not do the exercise, seek immediate medical help. Okay, let's assume all those things are good and you're feeling pretty good. Let's start talking about the exercises. So Elijah's going to help us. We're going to demonstrate the first exercise, standing lumbar extension. Okay, we're going to show this from a side view. Okay, so we're going to have Elijah turn and we're going to have him face this direction. We're going to place his hands on his hips like this. We want to keep his knees nice and straight as he does this particular movement. We're going to lean backwards, Elijah, as far as you can go, like that, till you feel good pressure. You're getting to the very end of the motion. If you have neck pain, you can pull your chin down and hold your chin down. The key is that we're getting that arch. We're going as far as we can till it stops, pressure on, and then pressure off. What I'd probably do is I would have Elijah widen his stance just a little bit. Let's go widen your stance a little bit. As you do that, it'll allow that pelvic girdle and a lot of people to go forward, and it's a little easier to do it. So try and avoid that narrow stance with this exercise. So let's go all the way back, Elijah. Pressure on and pressure off. Okay, it's about that tempo. We're going to do 10 times every 2 hours for about five sessions during the day. I would say about 3 to 5 days you'd see a trend if it's starting to make a difference in you. Either one, you feel like you can get up a little bit better, you have less pain at night, You're getting better tolerance for sitting. All those things should change. You may not notice it actually during the movement. If you have pain when you're doing it, remember that whole idea about centralization and peripheralization, the movement of pain. So let's try that one more time. Come all the way back, pressure on, and then pressure off. This is just one version of this exercise. We're showing some of the ones that we just commonly do here. Okay? We're going to start out this time, we're going to start lying down. Okay? You can do this in a bed. It's preferable to do it on a firmer surface. So you can get down on the floor. That would be better. A little firm surface. If you can't, that's okay. Then start off in the bed. So some people will take a little while, I'd say 2 or 3 minutes, just to rest here for a moment to make sure they're comfortable. Sometimes they can't go right into the exercise that I'm going to show. But this is the safest, gentlest progression we can do. So the first thing we're going to do is we're going to tell them to prop up on their elbows. So you're going to come up on your elbows, prop up like that. And all we're trying to do is getting a little bit of that curve in the lower back. We'll hold. You can hold here 1 or 2 seconds and then go back down. Okay, and then you'll do it a series of 10 times. You can do that, 1 or 2 seconds. Sometimes you can go even a little bit more. We're shooting somewhere between 10 and 20 times per every 2 hours. Okay, and sometimes this will feel, yeah, well, it's feeling better. It's feeling better. That's great. Some cases they'll say it really feels horrible. I just can't get up. As soon as I go up, I'm getting, let's say, more leg pain down here. One adaptation we can make is we're going to take a couple pillows. We're going to put it around the midsection here. So let's have you come up, Elijah. And then you're going to flatten out. Now in this position, we're going to let them just rest flat, let your head go down. And we're going to actually move this a little further forward. There we go. There you go. And then back down. And we're trying to get the back to flatten out a little bit. Sometimes we have to start in this position and do the prone prop again. So let's try the prone prop. So prop your elbows up. Now he's getting a little less of a curve, and sometimes you have to do that first step with a couple pillows, and then eventually move down to one where you're actually on the table or on the floor. Okay? So now we're going to assume Elijah feels pretty good. All right? Pain's not getting worse. Let's go take out one pillow. It's better if you have a spouse or a friend that can take that. Sometimes when you're having a lot of back pain, it's hard to move out of that position without some help or removing the pillow. Feels pretty good. We're going to take the next one out. Obviously, Elijah's not in pain right now. He's moving pretty quickly, but that's okay. Now, the next progression, we have the prone prop. Then we're going to go into a prone press up. So let's go ahead and put our hands underneath our shoulders like this. So we're going to take this hand like so. So this hand should be directly underneath the shoulder. We're going to press up like we're doing a push-up, but we're letting our hips sag. Okay, so all the motion is occurring from our arms pushing through. So let's try that, Elijah. So push up. And a lot of times people want to use these lower back muscles to lift you up. You don't want to do that. You want to really let the arms do all the work and really let everything sag down. You see there's these little bones in the front, you'll feel on the front of your hips there. You don't want those to go too far off the table, okay? And then come back down. So let's do a series of 5, okay? So all the way up, pressure on, and I'll say breathe out and sag. All of a sudden see like everyone kind of sinks down a little bit more. But you got to get to the end of the stretch. Okay, the end of, he should go to the point where he doesn't feel like it makes a difference. Like he can't go any further. I can't go any further. So let's try that one more time. All the way up. And then back down. So some people, they'll say, I'm just not getting to the end of the motion. Like I know what you're telling me to do, but I still can't go any further. In the clinic here, we can take the table here and we can prop this up a little bit. So the starting position with the hands are a little higher up. So let's try that again. He can go a little bit further. Let's press up. And then back down. So we can take a bolster or like one of those foam rollers and hold the foam roller, or even a pillow just to bring it a little higher where you place your hands. Your hand should be just underneath your hands, not underneath your whole body. But it's a little modification for our people that are a little bit more mobile and need a little extra height to get that full extension for that type of background. The thing about backs is you don't have something to compare it to. With the arm exercise, you can definitely tell, which one are we trying to get close to the opposite side. Spine, we have to kind of explore it and push and try and stretch until we know we're getting to the end. Okay, our last tip, all these things are positions or movements. Now, one thing we do in the clinic here that you can do at home, it requires a little bit of creativity, okay? But it's called a prop positioning. So what we're going to try and do for Elijah here is we're going to have his, for the sake of this one, we do it here. We want to be in line with this table. We're going to, Elijah, let's move you up a little bit so you're a little higher up. So right about here, okay? And we're going to prop you up and we're going to lift this table up. Elijah's going to stay flat, so just lay as flat as you can. You want to have their head symmetrical, and you want everyone in a very comfortable position. So we'll prop up to the point where they're in a stretch position. They say, wow, that's at the very, is that the very end?
Yes.
It's at the very end. Okay, so that's at the point where he's feeling a good steady stretch. The nice thing about this is you can prop yourself up and use time instead of actively moving into it. And people that are very sensitive, sometimes it's easier for them just to lay or lie in this position and just prop themselves up. I would start out with a very short duration, 30 seconds to a minute, and then some people, we can actually move them up to 5 to 10 minutes. But you start out, I like to kind of go into 30-second increments when you do this on your own. Because sometimes you don't realize how intense that stretch is until you take them out, and we'll lower them back down in the clinic. And if we did it too much, they'll say, wow, that was too intense, and they'll actually feel like they're having more pain. So if you're doing this exercise, obviously you don't have a table like this, but what you can do to modify this at home is taking a couple pillows and prop it underneath the front of your body, similar to what we were doing earlier. So let's have you lift up, and I'm just going to put a couple of these in front. Obviously this is a very short prop, okay, but in some people that are very acute pain, that's all they can tolerate. So we're taking a couple pillows and we're creating that curve without him moving. You can also do this at the end of a couch where you have the end of that armrest. You can prop a couple pillows there. If you have one of those wedges that some people use for reflux, you can prop them up on the wedge. The key is that you have to get to the point where you actually feel a stretch. But in cases of this, 30 to 60 seconds is a good starting point, and go up by 30-second increments, all right? So that's this is just the prop, and you're using time to create a very gentle stretch, okay? Listen, if you like this video and this helped you out, please subscribe, turn on your notifications so you know when our next video is coming on, and place a comment if you have any questions about exactly what we're talking about, all right? Here's to you moving better.